Listen, if you've been hearing a ringing, buzzing, or hissing sound in your ears and there's no external noise around you, I want you to stop for a moment and breathe. That sound can feel frightening. It can feel constant, intrusive, even overwhelming. Many people panic immediately. They think something is terribly wrong. They assume it will never go away. But before you jump to fear, before you search for the worst case scenario, there is something very important you need to do first. That ringing, often called tinnitus, is not just about the ears. It is deeply connected to your brain, your circulation, your stress levels, and your overall health. When your body is under stress, when your muscles are tight, when your muscles are tight, when your neck is stiff, when your blood pressure rises, your auditory system becomes more sensitive. The brain turns up the volume internally. What might have been a faint signal becomes loud and disturbing. The first thing you must do before anything else is reduce the tension in your body. Sit upright, take a slow breath in through your nose for 4 seconds. Hold it gently, then release slowly through your mouth for 6 seconds. Hold it gently, then release slowly through your mouth. Do this 5 times. This simple act lowers stress hormones. It improves oxygen flow. It begins to quiet the fight or flight response that amplifies the ringing. Now gently massage the muscles around your jaw. Many people grind their teeth at night or clench their jaw during the day without realizing it. The temporomandibular joint sits very close to the ear canal. Tightness here can increase pressure and irritate nearby nerves. Use your fingertips and make small circular motions just in front of the ears. Then move down to the sides of the neck. Massage slowly. Feel those muscles soften. You may be surprised how much tension you've been holding. Next, check your posture. If your head is pushed forward all day while looking at a phone or computer, you are compressing the cervical spine. The nerves that travel from your neck to your ears can become irritated. Gently pull your shoulders back. Lengthen the spine. Imagine a string lifting the crown of your head toward the ceiling. Proper alignment improves blood flow to the brain and inner ear. Hydration is another critical step. The inner ear relies on proper fluid balance. Even mild dehydration can affect how those delicate hair cells function. Drink clean water throughout the day. Avoid excessive caffeine and energy drinks as they can stimulate the nervous system and intensify the perception of ringing. Before you reach for medications or assume permanent damage, consider circulation. The inner ear is extremely sensitive to blood flow. Poor circulation, high blood pressure, and inflammation can all contribute. Gentle neck stretches, light walking, and deep breathing improve vascular flow. Move your body. Do not stay sedentary. Even a 10-minute walk can increase oxygen delivery to the auditory system. Another essential factor is sound environment. When you sit in total silence, the brain focuses on internal noise. It amplifies it. Instead of testing your ears in a quiet room, introduce soft background sounds, natural white noise, gentle rain, ocean waves, or low instrumental music can help retrain your brain not to fixate on the ringing. The goal is not to fight the sound aggressively, but to reduce its dominance in your awareness. Stress is one of the biggest amplifiers. When you worry about the ringing, you activate the limbic system, the emotional center of the brain. That emotional reaction makes the sound seem louder. It becomes a cycle. The more you fear it, the more noticeable it becomes. Break that cycle early. Tell yourself calmly, my body is reacting. I am safe. I am working to restore balance. Your thoughts directly influence how your brain processes sensory input. Sleep is equally important. Lack of sleep heightens sensory sensitivity. Create a calming bedtime routine. Dim the lights, avoid screens at least an hour before bed. Use soft ambient sound if needed. Deep rest allows neural pathways to reset. Now let's talk about inflammation. Processed foods, excessive sugar, and high sodium intake can contribute to fluid imbalance and vascular strain. Focus on whole foods, fresh vegetables, healthy fats, lean proteins. Omega-3 fatty acids support circulation. Magnesium-rich foods help relax muscles and nerves. These are foundational changes that strengthen the system from within. If the ringing started suddenly after loud noise exposure, protect your ears immediately. Avoid further loud environments. Give your auditory system time to recover. But do not isolate yourself in silence either. Gentle sound exposure is healthy. Protection, not deprivation, is key. Sometimes neck injuries, even minor ones, can trigger tinnitus. If you've had whiplash, poor posture, or chronic neck tightness, consider gentle mobility exercises. Slowly tilt your head side to side, rotate gently, never flow. The goal is to restore flexibility and nerve flow. You must also consider medications. Some drugs can irritate the auditory system. If the ringing began after starting a new medication, speak with a healthcare professional. Do not stop anything abruptly, but be aware of potential connections. Most importantly, understand this. Your brain is adaptable. Neuroplasticity is powerful. When you respond calmly and proactively, the brain can reduce the perception of tinnitus over time. Many people experience significant improvement once stress, posture, circulation, and inflammation are addressed. Panic will not help you. Fear will not heal you. Your body is communicating. It is asking for balance. Before you do anything drastic, before you assume the worst, reset your system. Breathe deeply. Relax the jaw and neck. Improve posture. Hydrate. Add soft background sound. Support sleep. Protect but do not isolate your ears. You are not powerless. Your nervous system responds to your actions. Small, consistent steps create profound change. The body has an incredible ability to rebalance when given the right conditions. Start with calm. Start with awareness. Start with simple corrective actions that support circulation, relaxation, and nervous system stability. Before you assume something serious is happening inside your ears, you must understand how powerful your nervous system truly is. The ringing you hear is not just a sound, it is a signal being processed and amplified by your brain. And the very first thing that determines how loud, how intrusive, and how distressing that sound feels is the state of your nervous system. When you are anxious, tense, or fearful, your body shifts into survival mode. Stress hormones rise, your muscles tighten, your breathing becomes shallow. Blood vessels constrict. In that state, your brain becomes hyper-aware of internal sensations, including subtle auditory signals that you would normally ignore. What might have been faint suddenly feels overwhelming. That is why calming the nervous system must come before anything else. Not medication, not panic, not endless searching online. The first response should always be regulation. Start with your breath. Slow, controlled breathing sends a powerful message to the brain that you are safe. When you inhale deeply through your nose and exhale, ease slowly through your mouth. You activate the parasympathetic nervous system, the branch responsible for rest, repair, and balance. With each slow breath, your heart rate steadies. Blood pressure begins to normalize. Muscle tension decreases. This alone can reduce the intensity of the ringing because the brain is no longer on high alert. Now bring your awareness to your jaw. Many people clench their teeth without realizing it, especially during stress or concentration. The jaw joint sits extremely close to the ear canal. Tightness in this area can irritate surrounding nerves and increase internal pressure. Gently place your fingers near the hinge of your jaw and make small circular motions. Let the muscles soften. Allow your teeth to separate slightly. That small act of releasing tension can significantly reduce strain around the auditory system. Move to your neck and shoulders. If your shoulders are lifted or rounded forward, if your head is pushed out in front of your body, you are compressing nerves and blood vessels that travel to the brain and inner ear. Chronic neck tension restricts circulation and irritates nerve pathways. Slowly roll your shoulders back. Lengthen your spine. Imagine a gentle lift through the crown of your head. Then massage the sides of your neck with slow, deliberate pressure. As these muscles relax, blood flow improves and neural irritation decreases. Your thoughts also play a powerful role. The moment you label the ringing as dangerous, your brain's emotional center becomes involved. The limbic system attaches fear to the sound. That fear increases vigilance, and increased vigilance makes the sound appear louder. It becomes a loop. You hear it, you worry, it feels stronger, you worry more. Breaking that cycle starts with reassurance. Tell yourself calmly that your body is reacting, not failing. The majority of tinnitus cases are not life-threatening. When you remove catastrophic thinking, you reduce the brain's need to amplify the signal. Another crucial factor is your breathing pattern throughout the day. Many people breathe shallowly from the chest, especially under stress. This reduces oxygen delivery and keeps the nervous system in a mild state of alarm. Practice diaphragmatic breathing. Place one hand on your chest and one on your abdomen. Breathe so that your lower hand rises while your upper hand remains relatively still. This engages the diaphragm, fully improves oxygen exchange, and signals relaxation to the brain. Sleep deprivation further overstimulates the nervous system. When you're exhausted, your sensory processing becomes more sensitive. Sounds, lights, and physical sensations feel more intense. Establish a calming evening routine, dim the lights. Step away from screens. Engage in gentle stretching or quiet reading. The goal is to lower stimulation before bed so your nervous system can reset overnight. Even 1 or 2 nights of improved sleep can noticeably reduce tinnitus intensity for some individuals. You must also reduce stimulants that keep your nervous system on edge. Excess caffeine, energy drinks, and high-sugar foods spike adrenaline and cortisol. These chemicals heighten awareness and tighten blood vessels, potentially worsening the perception of ringing. Gradually lower your intake and replace those habits with hydration and balanced nutrition. When your internal chemistry stabilizes, your auditory perception often stabilizes as well. Gentle physical activity is another powerful regulator. A short walk, light stretching, or slow yoga movements increase circulation and release stored tension. Movement metabolizes stress hormones. It grounds you in your body instead of trapping you in anxious thoughts about the sound. After movement, many people report that the ringing feels less dominant because the nervous system is shifted into a calmer state. Perhaps most importantly, stop constantly checking for the sound. Each time you test whether it is still there, you reinforce its importance in your brain. The auditory cortex learns what you pay attention to. When you repeatedly focus on the ringing, you strengthen that neural pathway. Instead, redirect your attention intentionally. Engage in conversation, read aloud, listen to soft background sound. Teach your brain that the ringing is not the priority. Your body is not your enemy. It is responding to stress, tension, and imbalance. When you calm your nervous system, you change the environment in which that sound exists. The volume often decreases not because the ears changed instantly, but because the brain stopped amplifying the signal. This is why regulation must always be your first move. Calm the breath, relax the muscles, correct posture, reassure the mind, improve sleep, reduce stimulants. Move gently. When the nervous system shifts from alarm to balance, the perception of ringing often softens naturally. The ears are not isolated structures sitting alone on the sides of your head. They are deeply connected to your blood vessels, your cervical spine, your jaw, your muscles, and your overall circulation. When ringing begins, many people focus only on the ear itself, but in reality, the issue is often influenced by what is happening around it. Improving circulation and reducing physical tension can dramatically change how intense or persistent that ringing feels. The inner ear is one of the most delicate and sensitive systems in the body. It depends on a rich, steady supply of oxygenated blood. Even slight reductions in circulation can disturb the tiny hair cells responsible for converting sound waves into electrical signals for the brain. When blood flow is compromised, whether from tight neck muscles, poor posture, dehydration, high blood pressure, or vascular stiffness, those sensitive structures can misfire. That misfiring may be interpreted as ringing, buzzing, or hissing. Start with posture. Modern life encourages forward head positioning. Hours spent looking at phones, laptops, and screens shift the head several inches in front of the shoulders as posture compresses the cervical spine and tightens the muscles at the base of the skull. Important arteries and nerves that supply the brain and inner ear pass through this region. Chronic compression can reduce optimal blood flow and irritate neural pathways. Gently drawing your head back over your shoulders, lifting your chest slightly, and relaxing your shoulders down can immediately reduce strain in this area. It may feel subtle at first, but consistent correction changes circulation patterns over time. Neck tension is another major contributor. The muscles along the sides and back of the neck often become tight from stress, poor ergonomics, or lack of movement. Tight muscles restrict vascular flow and compress on nearby nerves connected to auditory processing. Slow, controlled stretches help restore mobility. Tilt your head gently toward one shoulder until you feel a mild stretch. Hold for several breaths without forcing it. Rotate your head slowly from side to side. Keep movement smooth and deliberate. The goal is not aggressive stretching, but restoring balance and flexibility. W is equally important. The temporomandibular joint sits just in front of the ear canal. If you grind your teeth at night or clench during the day, tension radiates directly toward the auditory structures. Chronic jaw tension can alter pressure dynamics and irritate nerves that influence ear sensation. Becoming aware of your jaw throughout the day is powerful. Let your tongue rest gently on the roof of your mouth. Allow your teeth to separate slightly and soften the muscles around the temples. If needed, gentle massage along the jawline and temples can relieve accumulated tension. Hydration plays a larger role than most people realize. The inner ear contains fluid-filled chambers that are essential for hearing and balance. Dehydration thickens bodily fluids and can disrupt normal pressure and signaling. Drinking sufficient water throughout the day supports fluid balance and vascular function. Many individuals underestimate how mildly dehydrated they are, especially if they consume caffeine regularly. Replacing some caffeinated beverages with water can improve both circulation and nervous system stability. Blood pressure must also be considered. Elevated blood pressure places stress on delicate blood vessels throughout the body, including those supplying the inner ear, Even slight increases can intensify pulsatile or constant ringing. Regular physical activity is one of the most effective ways to regulate blood pressure naturally. A brisk walk for 15 to 20 minutes increases heart efficiency, enhances oxygen delivery, and improves vascular elasticity. Movement keeps blood flowing smoothly rather than stagnating. Inflammation is another hidden factor. Diets high in processed foods, refined sugars, and excessive sodium contribute to systemic inflammation and vascular stiffness. When blood vessels lose flexibility, circulation becomes less efficient. Choosing whole, nutrient-dense foods supports vascular health. Leafy greens provide magnesium, which relaxes muscles and blood vessels. Healthy fats support cellular integrity. Balanced meals stabilize blood sugar, preventing spikes that stress the circulatory system. Sedentary behavior compounds the problem. Sitting for long periods reduces circulation, particularly in the upper back and neck. Make it a habit to stand up every hour. Roll your shoulders, stretch your arms overhead. Perform gentle neck movements. These small actions prevent stiffness from accumulating and keep blood moving freely toward the brain. Even breathing influences circulation. Shallow breathing limits oxygen intake and reduces efficient blood exchange. Deep diaphragmatic breathing enhances oxygenation and promotes vascular relaxation. When oxygen delivery improves, tissues function more efficiently, including those within the auditory system. For individuals who have experienced minor neck injuries, such as whiplash or strain, scar tissue and muscle guarding can alter cervical alignment. In these cases, gentle mobility, exercises, and when appropriate, professional evaluation may help restore structural balance. The key is not forceful manipulation, but gradual improvement of movement and alignment. Reducing physical tension also means evaluating daily habits. Carrying heavy bags on one shoulder, sleeping with poor pillow support, or working at an improperly positioned desk all contribute to chronic strain. Adjusting ergonomics so that your screen is at eye level, your shoulders are relaxed, and your spine remains neutral can reduce ongoing stress to the cervical region. Improving circulation and reducing NG tension is not about one dramatic action. It is about consistent small corrections. Each stretch, each posture adjustment, each glass of water, each walk contributes to better blood flow and nerve function. The inner ear thrives in an environment of steady circulation and relaxed musculature. It's when you remove compression, reduce inflammation, and support vascular health, you create conditions where the auditory system can stabilize and function more smoothly. The way you respond to the ringing determines how powerful it becomes in your life. The sound itself may begin as a simple signal, but the brain decides whether it is important, threatening, or irrelevant. When you react with fear, frustration, or constant monitoring, you unintentionally teach your brain that this sound matters. And what the brain believes is important, it amplifies. This is why retraining your brain and breaking the fear cycle is one of the most critical steps in reducing the suffering associated with tinnitus. Your brain is not a passive receiver of sound. It actively filters information every second. Right now, there are countless background noises around you. Air movement, distant traffic, subtle electrical hums. But you do not consciously notice most of them. That is because your brain has learned they are not important. Tinnitus can follow the same path. Through a process called neuroplasticity, the brain can learn to deprioritize the ringing. But this only happens when you stop reacting to it as a threat. The moment you hear the ringing and think, this is terrible, this will never stop, something is wrong, so your emotional center activates. The limbic system attaches anxiety to the sound. That anxiety increases alertness. Increased alertness makes the sound seem louder. Then the fear grows stronger. This loop can continue indefinitely unless you interrupt it intentionally. Start by changing your internal dialogue. Instead of labeling the ringing as dangerous, reframe it as a neutral body signal. Tell yourself calmly, my brain is picking up a sound. I am safe. That simple shift reduces emotional intensity. When the brain senses safety, it gradually lowers the amplification. One of the most powerful strategies is redirecting attention. Constantly checking whether the ringing is still there strengthens the neural pathway associated with it. Every time you pause in silence to test your ears, you reinforce its importance. Instead, choose to engage your focus elsewhere. Read aloud. Have a conversation. Work on a task that requires concentration. The brain can only prioritize so many signals at once. When your attention is absorbed, the ringing often fades into the background. Complete silence can make tinnitus feel louder because there is nothing else for the brain to process. Introducing gentle background sound can help retrain perception. Soft white noise, nature sounds, or low instrumental music provide neutral auditory input that competes with the ringing. Over time, the brain begins to blend the tinnitus into the broader sound environment rather than isolating it. Sleep plays a central role in neural retraining. During deep sleep, the brain reorganizes and resets sensory pathways. When you are sleep-deprived, sensory signals become exaggerated. Establishing consistent sleep patterns allows the brain to regulate itself more effectively. Even small improvements in sleep. Peak quality can reduce daytime sensitivity to tinnitus. Mindfulness techniques are also powerful tools. Instead of fighting the sound aggressively, practice observing it without judgment. Sit quietly for a few moments and notice the ringing as if you were listening to a distant hum. Do not label it good or bad. Simply acknowledge it and return your focus to your breath. This teaches the brain that the sound does not require an emotional reaction. Over time, the intensity often diminishes because the fear response is no longer attached. Patience is essential. Neuroplastic change does not happen overnight. The brain learns through repetition. Each time you respond calmly, you weaken the fear association. Each time you redirect attention, you strengthen alternative neural pathways. Consistency builds momentum. Physical relaxation enhances this process. When your body is tense, the brain remains alert. When your muscles are relaxed and your breathing is steady, the brain receives signals of safety. Pairing relaxation practices with sound therapy accelerates retraining. For example, listening to soft ambient noise while practicing deep breathing teaches the brain to associate calmness with auditory input. It is also important to reduce the habit of researching symptoms obsessively. Endless searching increases anxiety and reinforces the idea that something catastrophic is happening. Information can be helpful, but constant investigation keeps the brain locked in threat mode. Trust that the body has the capacity to adapt. Engaging in meaningful activity shifts focus outward. Exercise, hobbies, social interaction, and creative work all provide strong sensory and emotional input that competes with tinnitus perception. When your life feels full and purposeful, the ringing low. Psychological dominance. Gratitude practices can also shift neural patterns. By deliberately focusing on positive experiences each day, you strengthen pathways associated with calm and well-being. This does not eliminate tinnitus instantly, but it changes the emotional environment in which it exists. Understand that many people experience tinnitus and eventually report that it fades into the background of their awareness. The sound may still be present at times, but it no longer controls their emotions or daily life. That transformation happens because the brain learns it is not a threat. You have influence over that learning process. The key is consistency, calmness, and intentional redirection. The less emotional weight you attach to the ringing, the less power it holds over your perception. Over time, the brain adapts, filters, and softens the signal, allowing it to become just another neutral background sensation rather than the center of your attention. Ringing in your ears is not the end of control. It is a signal that your body needs balance. When you respond with fear, tension, and panic, you unknowingly amplify the very thing you want to silence. But when you respond with calm, awareness, and intelligent action, you begin to shift the entire system in your favor. First, you steady the nervous system. You slow your breathing, relax your jaw, release the neck and shoulders, and tell your brain that you are safe. This alone can lower the intensity because the brain no longer feels the need to stay on high alert. Then you support circulation and reduce physical strain. You correct posture, hydrate properly, move your body, nourish yourself with anti-inflammatory foods, and create an environment where blood and oxygen can flow freely to the delicate structures of the inner ear. Finally, you retrain the brain. You stop obsessively checking for the sound, you reduce emotional attachment to it, you introduce gentle background noise, improve sleep, and redirect your focus toward meaningful activities. Over time, neuroplasticity works in your favor, and the brain begins to treat the ringing as unimportant. This is not about ignoring your body. It is about responding wisely instead of reacting emotionally. It is about understanding that the auditory system is deeply connected to stress, posture, circulation, and mindset. Small, consistent changes compound. A calmer nervous system, improved blood flow, reduced inflammation, better sleep, and a retrained focus create a powerful foundation for recovery. Many people discover that once they stop fighting the sound and start restoring balance, its intensity gradually softens. The goal is not immediate perfection, but steady progress. Your body is designed to adapt. Your brain is designed to rewire. And when you give both the right conditions, improvement becomes possible. Take control of what you can control, calm your system first, and trust your body's ability to rebalance itself.